Welcome to Path to Medicine, the podcast where we explore real stories from healthcare professionals to help young students understand the medical world. I'm Sarah.
And I'm Zara. Today, we're joined by Dr. Yumna Mohideen, a specialist in restorative dentistry who graduated with distinction from Barts and The London, Queen Mary University of London.
She later completed her master's in restorative dentistry at the prestigious UCL Eastman Dental Institute.
Dr. Yumna is not only an accomplished clinician, but also a mother of three, a philanthropist, and a mentor dedicated to guiding newly qualified dentists through her online platform. Her journey is a wonderful example of how passion, balance, and purpose can come together in a meaningful career.
Hi, Dr. Yumna.
Hi, Sarah and Zara. Thank you for having me on this podcast.
Yeah, it's great to have you.
What inspired you to choose dentistry as a career?
Well, I've always been drawn to healthcare because I really love the idea of helping people. And it's not just physically, but emotionally as well. So, dentistry really appealed to me because it kind of sits in the intersection between science and art. And also, you have the human connection. And you also use your hands creatively. So you can really make a real difference to how people feel about themselves. And I think what really inspired me was the fact that I can transform someone's smile and change their confidence and into the way that they interact in the world.
Yeah.
And yeah.
Yeah, no, those are very amazing reasons. Yeah, so lots of our listeners are students and they might not know the exact steps to becoming a dentist. So we were wondering if you could please walk us through your journey from school to dental school and to where you are today.
Of course. I started off with like obviously good GCSE grades, and I chose A level biology, maths, and chemistry. And obviously, you have to get good grades, obviously. In the meantime, dentistry is like a 5 year degree, and it's very academic, but it's also got a lot of clinical training. After I graduated, I completed my foundation training, which is like your internship. This is when you start treating patients independently, but you have a mentor and you also learn the business side of dentistry. So you learn about everything about, for management, managing patients, managing your nurses, your receptionists, how to order products, and then on top of that, dealing with patients and learning at the same time. And you have a supervisor that supports you during that time who's also a dentist. It's a really big step, and it's a really a good for learning because you build a lot of confidence during that time, and you're constantly taught and mentored. But over time, I discovered that I was quite passionate about restorative dentistry. So that's like the bread and butter of dentistry. So like crowns, bridges, implants, dentures, and basically that you restore a person's smile and restore the function of a mouth in with the restorative dentistry. So I later pursued a master's degree at the UCL, and the dental part is the Eastman Dental Institute. So it's one of the leading centers for postgraduate education for dentistry in the UK. So currently now I'm a specialist in restorative dentistry, and alongside my clinical work, I also mentor a newly qualified dentist, helping them build confidence and like refine their skills and navigate the early stage of their career, which when I qualified so many years ago, that wasn't something that was freely available. I only had my foundation year. And then after that, you were kind of put into the big dark world of treating patients. And sometimes it can be quite lonely without having a mentor that you can approach. So I want to be available for as many young clinicians as possible, basically, after your foundation year.
I honestly think like the specialty of restorative dentistry is really, really interesting. But I wanted to, know more about were there any key moments that you thought, yes, like dentistry is the right path for me?
I mean, obviously, when you're young, you've got to figure out. I mean, dentistry is a career where you start treating patients very early on in your profession. Whereas if you compare it to medicine, you go through medical school, And then it's only after you qualify as a doctor that you kind of figure out what path you want to go to. So dentistry is something that you've already figured out your path. You're already going to treat a patient's mouth. And I think what really, really defined the fact that it was right for me is that I did my work experience and I really figured out that I was quite a hands-on person. And I like that I could be hands-on very early on in my career. And not only that, that you treat different types of patients all the time. So you treat children, you treat adults, and every patient that walks through your door is different. So that this is treating patients along the way, I think something that really defined the fact that it was right for me is that just seeing that patients who are afraid, who are anxious, and you build them and you build their confidence and you treat them and you help them to not be afraid of the dentist is also a very defining moment in your career as well, because a lot of patients are very afraid of coming to the dentist for some reason. So you just got to remember that dentistry is not just about teeth, it's also about trust and reassurance and giving back people their confidence. So and that's what that one of those things is, because of that I really knew I like that part of dentistry. I like the empathy, I like helping people and just giving them their confidence back.
Yeah. I love the social connection that's a part of your job. And so I wanted to know if there were any challenges, maybe between patients or maybe about dental school that you might want to share with us or like let us know about.
Okay, so obviously a dental school is like a minimum of 5 years in the UK. I think initially one of the hardest part was obviously the volume of things that you learn. You learn things from anatomy, physiology. I think nowadays they do a more of a problem-based learning, where you learn things in a different way to how we were taught back in dental school, but it's all the same things that you're learning. But I think obviously it's the volume of things. I think one of the biggest challenges was like believing in yourself and knowing that you can do it, because you are surrounded by so many people who are very capable and very confident. But I think once you realize and own the fact that you are in dental school and you can do it is such a big achievement. And another thing was that the final exams are very, very tough. There's a lot of volume, there's a lot of things to learn. You've got to get a lot of sign-offs. You've got to present clinical cases. You see unseen cases, but it's a real test of your organization and resilience. But it's all worth it. And these challenges just make you. So I definitely feel that if you're inclined in the medical career, if you want to be hands-on earlier on in your career, and if you want a good work-life balance, I would recommend dentistry.
So I wanted to ask, what would you say to students who feel nervous about handling these challenges, especially in such a difficult and really stressful career, and even like studying in uni is pretty stressful. So what would you say to such students?
I think you gotta keep reminding yourself about why you are doing dentistry, why are you studying, why you have those goals, and I mean, for me, I genuinely realized that I loved dentistry, and I also realized that if I needed to ask for help, it's not a weakness. It's very important to talk to mentors and tutors and also friends and colleagues who've been through it. Because when you are in dental school, you are with senior students as well, so you can learn from them, you can take advice from them. So I think making sure that if you have a challenge, you make sure that nothing. You can always ask for help and take other people's help and take their advice. And just remember that confidence grows slowly. So every time you get a small success, you should be proud of that. And it's just a step forward in the right direction. So this is what I would, this is how I kept myself motivated.
Yeah, so you talked about learning from senior students that were in your same batch. So we wanted
Yeah.
to ask, like, we know that every career teaches a person something. So what were the biggest lessons you've learned from being a dentist? Maybe it's from school or it could be from like I guess students around you or like friends and teachers in general.
I think the most important thing I have learned, honestly, is you should really have balance in your life. Balance in your life when it comes to the dentistry, and balance in your life with your family life. And you also need to just make sure that you take the support from other clinicals, from your colleagues and from your mentors. And so if you do feel pressured or anything like that, you can solve these problems. So yeah.
We all also wanted to ask, was there a particular patient or experience that has stayed with you, like something very meaningful that reminded you why you chose this career?
Um, Basically, I think during my restorative training, I treated a patient who was very conscious about her smile. Like she avoided patients for a very long time. She was also very nervous, but obviously, after sitting with her in the chair, talking her through it, spent quite a long time with her, a lot of appointments, and completed her treatment. We gave her kind of like a smile makeover, and she looked in the mirror and she was really, really happy. Like she was so happy, she just kind of cried and she just really couldn't even believe the journey that she had gone through. And she was so grateful that I was so patient. Um, I think that really made it really worthwhile for me. So it's not just about restoring their teeth, it's about restoring their confidence and helping people rediscover themselves. And I think that's something that I'll never forget, really.
Yeah. Um, so if a teenager was listening to this conversation right now or wanted to ask you a question, what advice would you give them about applying to like dental school or applying to become a doctor in general?
Well, I think I'd say definitely explore your options, explore about the medical field, try shadowing a dentist. I would say shadow a medic as well. I would say also not only shadow medics and dentists, I would also say shadow other people in other professions. Then you really realize that dentistry or medicine is a career for you because you've kind of put away those other ones. Do you understand? So, I mean, when I wanted to be a dentist, I shadowed other professions. Like I shadowed a lawyer, I shadowed, other professions. And I actually, after shadowing a dentist and a doctor, I actually realized that I really wanted to do dentistry. I also feel like you should do some volunteering in the given field. Like sometimes in a hospital, you can work on the children's ward, or you can work with disabled children or like less fortunate children. And that's also very rewarding. And you can see how you need to interact, how you can develop your empathy skills. So I just say like just yeah, I would definitely say do that. And just go for your dream, just go for it, concentrate, work hard, and inshallah everything will work out in the end. So like if you definitely want to do something in healthcare, it's the most one of the most rewarding professions, I would say. Not just for now, it's just for everything, for all walks of life. Like you could be walking in the street, and even if you're a dentist, you have medical knowledge, you could help that person. You're always looking, like you always want to help somebody. So it's just such a rewarding feeling, not just for you but for the patient as well.
So, also you mentioned how work experience is really important in deciding whether a career is right for you. I think
Mm.
also knowing the skills that are required in such a field is critical. So,
Mm.
you're wondering what skills or qualities do you think really help someone succeed as a dentist?
I think you need to be patient, you need to be empathetic, and you need to have good communication skills. But of course, as a dentist, you need to have good manual dexterity. So you need to be you need to have good attention to detail. But also you need to really make sure that you know how to make a patient feel important and comfortable, and you need to be able to listen. And you also got to remember that dentistry is like you got to learn for your life basically. So you got lifelong learning there. There's always new techniques, there's new materials, there's new technologies which are always emerging, and that's very exciting because you're constantly growing and you're constantly improving. And over time with dentistry, you can have a good work life balance, as I mentioned before. So that becomes really valuable in your later life, especially if you want to have a family. I think for me, dentistry just worked really well. Before I had a family, I was working like 5 days a week. After I had a family, and even after I became a specialist, I was working 2 days, sometimes 3 days. Other days, I used to mentor, like in clinics, young dentists. So either way, I think for me, dentistry is just the ideal profession if you want to get into healthcare. But yeah.
Dr. Yumna, thank you so much. This has been a really inspiring talk. And personally, I really want to be a dentist, and so like I think I've learned a lot from your experience. And yeah, I think also like the fact that you mentioned about the work-life balance, being a positive. I also wanted to ask you, as our final question, what are like any other benefits or any other things that you loved about being a dentist besides things that you've already mentioned, like the work-life balance? Is there like anything else that you'd like to leave us with for any final comments?
I think I'd say I think I would say that, when you're in the profession of dentistry or medicine, you always doubt yourself. You have imposter syndrome. Even people who feel really confident always doubt themselves. But what I would say is, don't get scared. Don't be afraid to try. Just build your confidence. Treat each patient is a learning experience, and every success is learning. So if you have the passion to help people and the determination to keep learning, you can do it. And dentistry gives back to you as much as you give to it. So it's like a lifelong learning career, and I would say, definitely, I would recommend it very, very highly.
Thank you so, so much for sharing your story with us. I think personally, even though I want to do medicine, not dentistry, I think I've learned a lot from today. It's really inspiring to hear about both the challenges and the rewards of your journey, and we really appreciate you being on our podcast, honestly. Thank you so much, Dr. Yum.
Thank you, Zara and Sarah. It was very kind of you to invite me onto your podcast, and I wish both of you the best of luck with everything. And if you ever need anything from me again, with any form of advice or anything at all, please do get in touch.
For our listeners, we hope this episode showed you that careers in healthcare aren't just about exams or textbooks, they're about resilience, growth, and a passion for helping others.
Join us next time on Path to Medicine as we talk to Dr. Bogdan. Until then, thank you for listening, and remember, stay curious and keep exploring the world of healthcare.